A cervical fusion procedure is typically done to treat herniated discs, degenerative disc disease, or spinal stenosis. And while cervical fusion is extremely effective in reducing symptoms such as pain and improving mobility, the recovery can be quite challenging. If you are about to undergo a cervical fusion, this video will help you to better understand what the recovery process looks like and how to get the best possible outcomes. Hi, my name is Jade Hutchison, and I am a licensed physical therapist at EW Motion Therapy in Birmingham, Alabama. Recovering from cervical fusion procedures are quite challenging, and you need dedication, patience, and careful management of your body movements while going through this. Here at EW, I create custom treatment plans for my patients to ensure the best possible outcomes. Today, I want to review with you what a cervical fusion is, the do's and don'ts of recovery, and how physical therapy can aid in the recovery process. First and foremost, it's important to know what a cervical fusion even is, so let's kind of discuss it. So what it is, it's joining of two or more vertebrae together in order to provide more stability for the neck. Now, this is done when conservative treatment, such as medication or physical therapy, fails to produce the outcomes you want, such as reduce pain or improve your quality of life. So what happens in the procedure is they go in and they take out all of the damaged tissue. They then take a bone graft, either from you as the patient or a donor graft, and they put that in as the disc in between the vertebrae. After they do that, they reinforce it with plates and screws, and over time, those fuse with the existing bone already there. This is typically done when someone has a herniated disc, degenerative disc disease, spinal stenosis, or other things such as tumors or infections. Recovery from cervical fusions can be quite challenging and require careful management of the body in order to restore mobility and get the best outcomes. So let's go over the do's and don'ts of recovery. For the do's, we want to make sure that you're listening to your doctor's orders. They are the ones doing the procedure and know the ins and outs, so listening to them is going to convey the best results. Number two is resting and relax. We want to set up the best environment for our body to heal, so making sure we have plenty of time to recover is essential. Number three is eating a nutrient-dense diet and drinking a lot of water. Again, we want to set up the best possible environment for our body to heal, and with proper nutrients, this can happen much quicker. And finally, keep a positive attitude. This is a really challenging procedure and it takes some time to recover. So with a positive outlook, this goes a lot smoother and it's way more enjoyable for you. Now for the don'ts. First and foremost, we do not want to lift anything heavy. Lifting things requires a lot of strength and it puts a lot of tension on the body, including the neck, and this isn't really cleared until later on in the recovery process. Number two is do not smoke. Smoking impedes on the recovery and the healing processes of our body, and this will prolong how much time it takes your body to recoup. Number three is do not drive. Obviously, we need range of motion in our neck to look left and right, so we don't want to be driving until cleared by your doctor or physical therapist. And finally, do not neglect your physical therapy. This is what's going to get you back moving on your feet and back to the life you want to live. And the more we neglect it or don't go to our visits, the longer this will be and the worse outcomes are going to be. Physical therapy is an essential part of the recovery process as it ensures that we have careful management of the body in a safe and effective way. When you go to physical therapy for this procedure, we obviously start with pain management. We have a lot of modalities we use to help reduce pain and a lot of techniques that we perform on the patient that help to, release tension and improve mobility. After the pain is managed, we then kind of fall into our mobility and flexibility. We want to restore as much motion in the neck as possible because, as we mentioned before, you need your neck to drive, to turn head left and right. And so we have a lot of manual techniques that we do that provide safe and effective treatment for neck motion and restoring this. We also want to emphasize strengthening. Strength is part of stability. So the stronger we are at the neck and around the surrounding muscles, it's going to provide you to be able to do all the activities that you once did prior to the surgery and do even more. And then lastly, we want to prevent further injury. This is where education comes into play. We are very passionate about educating our patients on, what their body's doing how to better take care of it in the future so that things like this don't occur down the road. A cervical fusion can be a very challenging recovery process, but with physical therapy, you can have an effective and safe treatment and then the best possible outcomes. If you want to learn more about physical therapy and how it can aid in your recovery, click the link in our description below to watch our video, What is Physical Therapy? This video describes the treatment methods employed by physical therapists to aid in recovery.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.